If you are over the age of 60, there is one thing you may be doing every single night that could quietly increase your risk of stroke while you sleep, without pain, without warning, and without a single symptom. No chest pain. No slurred speech. No dizziness to alert you. You go to bed feeling perfectly fine. But by morning, everything has changed. You wake up confused. Unable to speak clearly. Unable to lift your arm. A stroke, silent, sudden, and life-altering. And the cause may be something as simple as the way you sleep. As a neurologist, I have seen far too many cases like this. And surprisingly, the cause is often not smoking, poor diet, or lack of exercise, but a common sleep habit that most older adults believe is completely safe. Today, I'm going to walk you through 9 dangerous sleeping positions and nighttime habits that may increase your risk of stroke, brain bleeding, or dangerous blood pressure spikes, especially during the hours when your brain is most vulnerable. If you or someone you love is over 60, this video could save a life, possibly your own. So please, don't change the channel. Let's begin. Part 2, Sleeping Flat on Your Back, the Dangerous Calm. Before we go any further, if you haven't subscribed yet, I encourage you to click the subscribe button and turn on the notification bell so you don't miss health advice designed specifically for you. If you like this video, type 1 in the comments. If you don't, type 0 so I know how to improve. Police car light dangerous habit number 1, sleeping flat on your back without a pillow. Lying flat on your back with no pillow, your head level with your body, looks harmless. Even comfortable. Arms at your sides. No pillow under your head. For many older adults, this is a habit formed decades ago. Some say it relieves back pain. Others believe it opens the chest or improves posture. But almost no one tells you this. Sleeping completely flat without elevating your head may quietly increase your risk of stroke during the night, and you may never feel it coming. When you lie completely flat, your head is at the same level as your heart. That sounds natural, but physiologically, especially for older adults, it's not. As we age, the blood vessels in our neck and brain lose elasticity. Blood flow becomes less efficient. The veins responsible for draining blood away from the brain now struggle against gravity. Instead of flowing freely, blood can pool, slow down, and even clot, especially in the early morning hours when blood pressure naturally rises. And when clots form during sleep, they don't stay quiet for long. A small clot blocking a narrowed artery can cause devastating consequences. Slurred speech. Facial drooping. Permanent disability. Or death. Let me share the story of Mr. Leonard Whitaker, a 77-year-old retired mechanic from Michigan. Leonard was strong, independent, and still repaired lawn mowers in his garage. Every night, he slept flat on his back without a pillow, hands folded across his chest, a habit from his Navy days. He said it helped him sleep deeply. One morning, his wife Mary found him half awake but unable to speak. His eyes were open, but one side of his face drooped. He couldn't lift his right arm. A scan in the emergency room revealed a clot in his left middle cerebral artery, an ischemic stroke commonly caused when blood thickens and clots during sleep in narrowed vessels. His carotid arteries were stiff. Blood had pooled for too long. And it was directly linked to his sleeping position. Doctors dissolved the clot, but Leonard never fully recovered. Today, his speech is slower. He needs a walker. Every night, Mary carefully supports his head with a wedge pillow. They both wish they had known sooner. What most people don't realize is that sleeping flat can impair venous drainage from the brain, especially with age-related vascular changes. In medical terms, your brain's plumbing system slows down. Stagnant blood becomes fertile ground for clots. Add nighttime dehydration and low oxygen levels, and you have a perfect storm. This position is especially dangerous for people with high blood pressure, atrial fibrillation, sleep apnea, carotid artery disease, or those taking blood pressure medications that lower nighttime pressure. The safest adjustment is simple. Elevate your head about 30 degrees. This allows gravity to assist blood flow, reduces intracranial pressure, and improves oxygen delivery to the brain. Even 1 or 2 supportive pillows can make a profound difference. And always choose a pillow that supports the natural curve of your neck, without pushing your chin forward. Some people think this is just about comfort. It's not. It's about blood flow to the most delicate organ in your body. It's about protecting your independence, memory, speech, mobility, and your identity. Leonard once told me, with tears in his eyes, "Doctor, if someone had told me this years ago, I would have changed. Let me be the one who tells them now." Part 3, Sleeping on your stomach, twisting the lifeline. And if that worries you, wait until you understand what happens when you sleep on your stomach, when your neck twists in a way that can cut off the arteries supplying your brain. If you're still watching and finding this helpful, comment 1 below so I know you're with me. Let's move on. Police car light dangerous habit number 2, sleeping on your stomach, prone position. Many older adults make a quiet mistake every night. It feels comfortable, familiar, harmless. Sleeping on your stomach. Maybe you started to ease back pain. Maybe you like the pressure on your chest. Maybe it feels safe, like being wrapped in a cocoon. But here's what your doctor may never have told you. Sleeping on your stomach may be one of the most dangerous positions for your brain. Medically, this is called the prone position. In younger people, it may not cause serious harm. But with age, circulation slows, arteries stiffen, and oxygen levels drop more easily, especially during deep sleep. When you sleep on your stomach, several dangerous things happen. Your neck is sharply turned to one side to allow breathing. This compresses the vertebral arteries, which supply oxygen-rich blood to the back of the brain, responsible for balance, coordination, and consciousness. Pressure may also be applied to the carotid arteries, especially if your head sinks into a soft pillow. Blood flow slows. Veins draining blood from the brain become twisted. Blood pools, thickens, and clots. These clots can remain silent for hours, until morning blood pressure spikes to sludge them and send them directly into the brain. The result is often a large stroke, sometimes fatal. I will never forget Mrs. Ethel Lawson, an 82-year-old retired teacher from Ohio. One morning, her daughter found her awkwardly lying on her stomach, slurring her speech, with no movement on her left side. Scans revealed a large ischemic stroke in her cerebellum, the part of the brain responsible for balance and coordination. The cause wasn't cholesterol or atrial fibrillation. Her carotid arteries were narrowed by age, and hours of sleeping with her neck twisted reduced blood flow just enough to form a clot. Ethel survived, but she no longer drives. She walks with a walker. Every visit, she tells me, "I never knew something as simple as how I slept almost killed me." Here's the science. Neck rotation in the prone position can reduce vertebral artery blood flow by over 40%. Chest compression limits lung expansion. Oxygen saturation drops. Carbon dioxide builds up. Cerebral blood vessels become unstable. As we age, we tolerate oxygen drops far less effectively. A 30-year-old may gasp and reposition. A 70 or 80-year-old may not. If you snore, have sleep apnea, or take sedatives or sleeping pills, stomach sleeping becomes even more dangerous. Your airway collapses more easily. Your body reacts more slowly. The risk of silent hypoxic stroke rises. If you or someone you love sleeps on their stomach, I strongly urge you to try side sleeping with a firm pillow that keeps the head aligned. Even better, sleep slightly elevated on your left side to protect both brain and heart circulation. These changes are not about comfort. They are about survival. Because the position that feels good may be placing deadly pressure on the arteries that keep your brain alive. Part 4, Sleeping with your head covered, silent suffocation. And remember, this isn't only about how you sleep, but also where pressure builds while you sleep. Next, we'll discuss a nighttime habit millions of older adults fall into, especially those with hip or shoulder pain, that quietly restricts blood flow and triggers nighttime strokes. And it happens on your favorite side. Police car light dangerous habit number 3, sleeping with a thick blanket over your head. Many older adults have a subtle, deeply ingrained habit, almost childlike. Covering the head with a blanket at night. Maybe to block a partner's snoring. Maybe to shut out light or drafts. Or maybe because that warm, quiet cocoon feels safe. But for older adults, this small habit can quietly become deadly. When you sleep with a thick blanket over your head, you're not just blocking light or sound. You are restricting airflow. Over the course of the night, oxygen levels drop. Exhaled carbon dioxide accumulates around your nose and mouth. Decades ago, your younger body may have tolerated this. But at 60, 70, or 80, your brain's ability to recover is very different. Low oxygen levels and high carbon dioxide during sleep increase the risk of your blood becoming thicker. In a vulnerable brain, this creates the perfect conditions for blood clots to form. Let me tell you the story of Mr. Richard Hale, an 81-year-old retired postmaster from Iowa. Richard was a quiet, thoughtful man who always loved sleeping in complete darkness. He told me he had covered his head with a blanket since childhood. His wife used to tease him gently, saying he looked like a tightly wrapped caterpillar every night, especially in winter. But it made him feel safe, calm, relaxed. So every night, Richard pulled the heavy blanket tightly over his head and curled up to sleep. Then one morning, Richard didn't wake up. His wife panicked when she found him barely responsive. His eyes could hardly open. When the ambulance arrived, his oxygen levels were dangerously low. Hospital scans revealed that he had suffered a silent stroke in the early morning hours. A blood clot had formed and blocked a small vessel deep within his brain. This wasn't caused by atherosclerosis or atrial fibrillation. It was caused by nighttime oxygen deprivation combined with age-related blood thickening, and one of the key risk factors was sleeping under a thick blanket that restricted airflow. You see, during deep sleep, especially REM sleep, your brain requires a constant supply of oxygen. When you repeatedly rebreathe stale air under a blanket, oxygen levels fall, the heart compensates by beating faster, and blood pressure begins to fluctuate. These repeated spikes and drops place stress on already fragile blood vessels. Add mild dehydration, slower circulation, and arteries stiffened by age, and you've created a perfect storm for clot formation. And the most frightening part? You may never know it's happening. You feel warm. You feel safe. But your brain is slowly suffocating. By the time damage occurs, you may wake up as a different person, if you wake up at all. Medical research shows that even mild hypoxia, lower than normal oxygen levels during sleep, is strongly associated with an increased risk of stroke and cognitive decline in older adults. And this risk isn't limited to people diagnosed with sleep apnea. It can affect anyone whose breathing is restricted by environment or sleeping position. If you sleep with your head covered, even if only in winter, it's time to reconsider. Instead of pulling the blanket over your head, use an eye mask to block light. Use earplugs for noise. Keep the room comfortably warm. Choose lightweight, breathable bedding. This isn't about comfort. It's about protection. It's about giving your brain the oxygen it needs to repair, recover, and survive the night. Because strokes don't only happen to other people. They happen to good people. Thoughtful people. People like Richard, who never knew a lifelong habit nearly took away his ability to walk, speak, and remember. Today, Richard sleeps with a wet pillow, soft lighting, and his blanket folded below his shoulders. He once whispered to me, "I never knew something that felt so safe could be so dangerous." He is not alone. Because what we don't know can hurt us, especially while we sleep. Part 5, Recliner Sleeping, the Overlooked Clot Trap. If sleeping with your head covered is dangerous, the next habit may be even more so. Millions of older adults rely on it for comfort, yet it may be quietly cutting off blood flow to the brain, starting with the way your arms rest beneath your pillow. Let me explain. If you're still watching and finding value in this information, type 1 in the comments so I know you're here. Let's continue. Police car light dangerous habit number 4, sleeping upright in a recliner. For many older adults, sleep becomes harder with age, not just falling asleep, but staying asleep comfortably. Joint pain, spinal stiffness, acid reflux, shortness of breath. All of these often lead to a common solution, the recliner. You may know someone who has completely abandoned their bed. Or that person may be you. Night after night, sleeping in a recliner becomes routine. A soft blanket, the TV humming quietly in the background. The chair reclined just enough. It feels safe. But sometimes, what feels safe is quietly dangerous. As a neurologist, I've seen how sleeping upright in a recliner can slowly and silently increase the risk of nighttime stroke. The human body is designed to rest while lying flat, allowing blood and oxygen to circulate evenly. But when you sleep in a semi-upright position, around 45 to 60 degrees, you place your circulatory system at a disadvantage, especially as you age. In this position, gravity does two harmful things. It pulls blood downward, away from the brain. It compresses the major veins in the legs and hips. The result? Blood flow slows. Blood pools in the lower limbs. The risk of clot formation rises sharply. In younger people, this may not be dangerous. But after age 60, everything changes. Blood thickens due to age-related dehydration. Blood vessels narrow after decades of wear. The heart pumps less efficiently. Slow-moving blood trapped in the lower body can form clots, small, sticky, silent threats that may travel upward during the night or early morning. It takes only one clot to block a vessel in the brain. And by the time you wake up, the damage is already done. Let me tell you about Barbara Keene, a 79-year-old retired florist from Kentucky. A warm woman with a sharp memory and a gentle smile. 5 years ago, after hip surgery, Barbara began sleeping in a recliner because lying flat was painful. She told herself it was temporary. But the pain lingered. And over time, the recliner became her bed. She often woke up stiff and dizzy, but managed, until one morning when her daughter found her still sitting in the chair, confused and barely able to move her left hand. Scans revealed a lacunar stroke, a deep, small stroke caused by a clot blocking a tiny vessel inside the brain. She had no major heart disease. No atrial fibrillation. What she did have was years of poor circulation caused by upright sleeping. Her legs swelled. Her ankles felt tight. She felt dizzy every morning when standing. The signs were there. She simply never imagined the recliner could become a stroke trap. Here's the medical reality. Upright sleeping reduces the effectiveness of the baroreflex, the body's natural system for regulating blood pressure. When you sleep flat, your brain and heart communicate easily to stabilize pressure. But when upright, especially if slouched or twisted, this reflex weakens, leading to unstable blood pressure. In older adults, this instability becomes dangerous. Add medications, dehydration, or compression from tight clothing or swelling, and you're facing multiple risk factors while believing you're simply enjoying a comfortable night's rest. So if you sleep in a recliner, or nap there frequently, consider this your wake-up call. Sleep isn't just rest. It's about positioning your body to protect your brain. If elevation is necessary, use a hospital-style adjustable bed. Or a firm wedge pillow that raises the torso without compressing the legs. And make sure to stretch and move your legs regularly to support circulation. Barbara now sleeps in her bed again, her head slightly elevated, with a body pillow supporting her hips. She often tells me, "I thought I was making things easier. I never realized I was making things more dangerous." Many people think danger comes from moving too much. But for older adults, danger often comes from staying too still in the wrong position for too long. Part 6, The Wrong Side, Chronic Arterial Compression. If you think recliner sleeping can restrict blood flow, wait until you learn what happens when you sleep on your favorite side with your arm tucked under your pillow. It feels natural, comfortable, but it may be one of the most harmful positions of all. Let me explain why. Police car light dangerous habit number 5, sleeping on the right side with the arm under the pillow, most dangerous. This is a position millions of people find comforting, especially older adults. You lie on your right side. A soft pillow under your head. Maybe another between your knees. And by habit, you slide your arm underneath. You fall asleep believing it's no different than how you've slept for decades. But as a neurologist, I must tell you, this is one of the most dangerous sleeping positions I see in older patients. Not because it causes pain, but because it quietly restricts blood flow to the brain night after night. Here's what happens. When you lie on your right side with your arm wedged under your head or pillow, you apply direct pressure to major arteries and veins in the neck and shoulder, including the carotid artery and subclavian artery. These vessels are the highways carrying blood to and from your brain. When compressed for hours, blood flow slows. Blood pools. Veins are squeezed. Arteries narrow. In the stillness of sleep, stagnant blood thickens. Clots form. That clot may remain in place for hours, until you shift position in the early morning. Blood pressure rises with dawn. The clot dislodges. Within seconds, the brain is deprived of oxygen. Let me tell you about Ellis Randall, a 75-year-old Vietnam veteran from North Carolina. Strong-willed and independent, he used to joke he could outrun his grandchildren. Every night, Ellis slept on his right side, just as he had since his military days. He curled his arm beneath his pillow to support his neck. One morning, his wife found him half out of bed, dizzy, unable to move his left leg. Scans revealed a right hemisphere stroke, caused by a clot in a central artery. Ellis didn't smoke. He didn't have diabetes. His cholesterol was normal. So where did the clot come from? Long-term compression on his right side, combined with years of sleeping on his arm, had damaged blood flow. Ultrasound showed narrowed carotid arteries. Night after night, reduced circulation allowed clots to form silently until one struck before dawn. Ellis survived, but his mobility declined. He now walks with a brace and attends weekly physical therapy. He once said quietly, "I never knew the way I slept could betray me." This position doesn't just affect arteries. It also compresses the brachial plexus, a bundle of nerves running from the shoulder into the arm. When compressed by body weight, these nerves don't just go numb. They send distress signals to the brain and disrupt sleep cycles without you realizing it. Over time, poor circulation and nerve pressure can cause microvascular damage that accumulates silently until it explodes. Older adults are especially vulnerable. Blood vessels stiffen and narrow. Blood becomes thicker. Recovery from restricted flow takes longer. Nerve resilience declines. If you've always slept on your right side with your arm underneath, it's time to change, not for comfort, but for survival. Try sleeping on your left side, with your head gently elevated. Keep your arms in front of your body or at your sides, not underneath. Use an ergonomic pillow to keep your neck aligned and relieve pressure on critical vessels. A small change may protect your independence, your memory, your ability to hug family, walk your dog, or say your grandchildren's names. You may not feel the damage happening, but your brain remembers. Your blood flow records it. And one day, your body responds. Because what you don't know while you're asleep can change everything when you wake up. Part 7, Nighttime Restlessness, the Body's Cry for Help. If sleeping on your arm is risky, wait until we talk about what happens when your body tosses and turns all night, and why restlessness itself may be a warning sign. Let me explain. Police car light dangerous habit number 6, frequent tossing and turning, poor sleep quality. As we age, a quiet restlessness often creeps in. You can't stay asleep. You wake frequently. You flip from side to side all night. You may blame aging, arthritis, or bathroom trips. But what if I told you this pattern could be your brain sending a warning, and worse, it could trigger a stroke? As a neurologist, I view sleep not just as rest, but as a critical time when the brain restores blood flow, balances pressure, and clears toxins. When this process is repeatedly disrupted, especially in older adults, the consequences can be quietly devastating. Every time you shift violently in bed, turning your head, adjusting your neck, you temporarily alter blood flow to and from the brain. In a healthy 30-year-old, this may not matter. But at 70 or 80, arteries are stiff. Veins are narrowed. Vessel walls are fragile. Each movement can create brief periods of reduced circulation. Add dehydration, low oxygen, or blood pressure instability, and risk skyrockets. Even more concerning is what we're beginning to understand. Frequent movement during sleep may not just be a symptom, it may be the brain gasping for balance. Let me tell you about Nancy Delgado, a 76-year-old retired piano teacher from Colorado. Elegant. Precise. The kind of woman who still ironed pillowcases. For months, Nancy woke exhausted despite sleeping 7 hours. Her husband noticed she constantly shifted every 10 to 15 minutes. They assumed it was normal aging. Then came morning headaches. Dizziness. One night, she woke with numbness in her right arm and slurred speech. Scans showed a small ischemic stroke, likely occurring hours before she woke. Sleep studies and vascular scans revealed the cause: poor sleep quality combined with intermittent hypoperfusion, temporary drops in brain blood flow caused by restless movement. Over time, unstable circulation allowed blood to pool in her neck vessels until a clot formed. Not from cholesterol. Not from heart disease. From fragmented sleep. This pattern is far more common than people realize. In older adults, broken sleep creates multiple dangers. Prevents normal nighttime blood pressure lowering. Raises cortisol, triggering early morning pressure spikes. Disrupts the glymphatic system, increasing vascular inflammation. Creates constant fluctuations in cerebral perfusion. These aren't just medical terms. They're early warning signs. Waking drenched in sweat, gasping, or with a racing heart. Your brain is distressed. Morning tingling, balance problems, neck stiffness? Not just aging. They may be your body begging for better positioning, hydration, and circulation. What can you do? First, treat restlessness as a symptom, not a habit. Avoid caffeine or alcohol late at night. Keep the room cool and dark, but use layered bedding. Use body pillows to stabilize joints. Most importantly, if you or your partner notice frequent awakenings or excessive movement, talk to your doctor about a sleep study. Nancy now sleeps with a soft cervical pillow, keeps water nearby, and practices slow breathing before bed. Her recovery is gradual. She told me, "I thought waking up tired was normal. I didn't realize it was a warning I ignored every night." She's right. When sleep becomes a battlefield, the body remembers. Part 8, Forgetting Before Bed, a Fatal Oversight. There is one more silent threat that works alongside poor sleep. It's often overlooked because it starts before you fall asleep. A missed pill. A skipped routine. A moment of forgetfulness. And it may be the only barrier between you and a life-changing stroke. Let's talk about what happens when you skip your blood pressure or heart medication before bed. Police car light dangerous habit number 7, going to sleep after skipping blood pressure or heart medication. For many older adults, taking daily medication becomes second nature until the night you forget. Or maybe you feel fine and decide skipping once won't hurt. You may not realize that missing even one dose, especially at night, can become a silent danger. Blood pressure follows a natural rhythm, higher in the morning, lower at night. This nighttime dip allows the body to reset. But in people with hypertension or heart disease, the body can't regulate this rhythm alone. That's what medication does. When you skip a nighttime dose, especially beta blockers, calcium channel blockers, ACE inhibitors, or anticoagulants, blood pressure may surge between 2 a.m. and 6 a.m., the exact window when most strokes occur. Heart rhythm may become irregular. Narrowed arteries can't handle the sudden pressure. Blood pools. Clots form. Let me tell you about Harold Green, a 72-year-old retired electrician from Wisconsin. One night, distracted during a football game, he forgot his pill. He told himself it was fine. It wasn't. By morning, he suffered a moderate ischemic stroke, caused by a clot that likely formed during an uncontrolled blood pressure spike. He thought missing one dose didn't matter. In older adults, with stiffer arteries and thicker blood, that single missed pill can be the tipping point. Physiologically, it's simple. Medication reduces vascular stress. Skipping it removes the shield. Pressure builds. Platelets activate. Clots form. In older adults, there is little margin for error. Harold now never misses a dose. He told me quietly, "I didn't know the danger was that close."